Well, good morning, sweeties. Today is the day. I am getting ready to get myself washed up, cleaned up for the hip replacement, March the 14th. So I have been spending the entire week just getting things ready, getting things done around the house. Because again, at least for the first 2 weeks, I'm just going to kick back, relax, go to physical therapy 3 times a week, and just heal. Because that's exactly what I'm supposed to do. So yesterday I went ahead and I just wanted to start with a fresh, clean head of hair because I don't know when I'll be able to go to the salon. It just is that it's easy to maintain. For 5 days, I have had to scrub. And I think you guys saw me on a blog where I picked it up in the store. So for 5 days, I've had to wash with this stuff. And it dries your skin out. You can't put anything on afterwards. So that's driving me crazy. So I'll take one more final shower in this, even though, part of doing surgery when you get into the OR is they're going to scrub down that right side. But anyway, I've removed all of my jewelry, earrings, the nose ring stays. They'll tape it up. I don't take it out and I always tell them the reason why. But I've taken off my necklace, my watch and bracelet will come off. But this is just pre-prep. So I'm going to go ahead and hop in the shower, get myself cleaned up, and we'll check back in later. Well, sweets, I am on my way to the hospital. My daughter is my driver today. We've got the baby grand, so my husband stayed at home with them, and my daughter is my driver because, once again, you can't take an Uber to have surgery. They're not going to operate on you if you don't have someone physically there with you. So I would encourage you to start arranging to have someone with you weeks before, whether it be a loved one, child, grandchild, an adult. Now 18 and older is considered an adult. So that's something that you have to remember. But anyway, I don't know how much vlogging I'll be able to do. I'll vlog as much as I can and take you guys along on this journey. It will be a lot easier for me to vlog afterwards. Hopefully I'll feel up to checking in with you guys and just showing you guys some things. But in the meantime, chat with you later. Okay, so I just finished my check-in process. It was a little longer than usual, but it's been a while since I've been at this facility. And so now, and then I'll wait for them to call me back.
Even if it's
okay, so we have gone through the gamut of getting my IV started. We finally got it started, and really delicious. So we're in the process of getting more blood. It's a requirement, and doctor's been in to mark the area. Make sure your area that you're going to have surgery on is marked. Make sure you know which limb, whether it be right arm, right leg, foot, so on. Know that. And then know your medical history. Just makes it a lot easier for everyone. Doctors, nurses. That's about all I have for you. And hopefully I will check back in with everyone afterwards.
Can I pop it?
Oh, like this. Blood work, IV. Okay, so I'm just waiting until it's time to take me back to the OR. Prep work has been done, and I don't know what else to tell you all. We've got me hooked up to the monitors. Got me in a warming blanket, which I think these are cool because it's really economical. No blankets, and it stays warm. Blankets, will cool off. Like bring another warm blanket. This here is hooked up to a little warmer, and so it stays warm all the time. So I've had very nice nurses and anesthesiologist, and so I'm in good hands. I've been at this facility before 3 years ago when I had my knee replaced, and so just
And the Oscar
waiting
goes
patiently.
to the most dramatic scene before surgery. Candace Portley, would you like to give your acceptance speech?
I won't be thanking my daughter because she's God, you know what, y'all? If you don't have supportive family, I
You can do
feel
a
sorry
dance in
for
the
you,
bed.
but I am so blessed to have supportive family. My daughter, tell you she's my ride or die, and she can also really be humorous, and sometimes you need humor during times like this. So, but yeah, she's amazing. I'm so blessed to have her, and don't know what I would do without her. So, okay, enough of that. Anyway, I don't know what else I can tell you guys. I think I stressed before. Make sure that you number one, know your medical history, because when you know your medical history, it's just going to make it easier and safer. It's going to make it easier for the doctors, easier for the nurses, but also safer because the anesthesiologist needs to know the meds that you're on, because again, you're going to be receiving drugs in the OR, and you won't be able to tell them, so they need to know, looking for any type of interactions that there might be. You're usually instructed to bring your medications with you, which I always do. That way I've got them. We can read labels, anything we need. Number two, know what you are having done. If it's a, breast lift, nose job, if it's a foot surgery, anything, know what you're having done. Because they will ask you over and over again, what's the doctor doing today? What are you having done today? So don't say left when you know it's the right, and vice versa. And then make sure the doctor is going to mark that area. And they 99.9% of the time, they mark the area, especially if we're talking limb surgery, limb meaning an arm or a leg. So the doctor came in and marked my hip, told me we're going to do an anterior incision. Yeah, I did. I said, is it going to be anterior or lateral? And I believe he said posterior. So a little bit towards the back. Posterior is towards the back, anterior is the front. They do lateral incisions, which means they have to have a longer incision. So what he's going to do is a little bit smaller incision, but I will tell you, this doctor is good, y'all. He is very, very good. Studied at Cleveland Clinic, and Cleveland Clinic is right up there with Mayo. So he took over for my other orthopedic doctor. If you guys are not, y'all, my allergies are still beat me up, and it's so hard to go through something like this, not feeling 100%. And yes, I know allergies are not a big deal, but as you get older, they do get worse, and I am miserable right now. So.
All right. So I've got some Precedex here.
So they're getting ready to give me some meds, so I'm gonna sign off for now. Okay, y'all. I am officially in my room. Yeah, as you can see, I've got oxygen on. I am in a lot of pain, but they're trying to keep it controlled. And the shoes to bend pen is going well. Vital signs were stable. And so this is what we're going to do for a while, at least till tomorrow. And I don't know if physical therapy is going to come up to start me getting up and moving, but they move fast because you don't want that new hardware to just kind of sit still. You want to get it moving, and so that's up there. I said surgery went well, everything's okay, no nausea. I usually have post-anesthesia nausea, and on nausea they kept that well controlled, and so now it's just kind of a wait and see throughout the day to see how I do, and that's that. So everything's doing great. Again with you later. I'm a little bit more awake now, and as I said earlier, just dealing with the pain, and that's about it.
My daughter told me that the doctor said everything went well and I was actually out of surgery in under 2 hours. It was about 2 hours, daughter. So this journey will continue. Just wanted to check back in, and the anesthesia is wearing off, so that's good. So, well, y'all, I have been up and down to the bathroom, and my hip is really hurting, so they brought me some more pain pills. I tried to eat a little something. I got nauseous. I tried to eat a little bit of a veggie burger with just some vegetables, and I got really nauseous. So I will just, I'll get hungry later. They brought me a carnation shake, 12 grams of protein, and I'll try to sip on that later. But in the meantime, I did save some salty chips, 2 baked chips that I might have for later for a snack. But anyway, this concludes day 1. Hopefully tomorrow I can vlog some of my physical therapy, and hopefully I'll get to go home tomorrow. If not, it'll be first thing Saturday. So until then, thanks for watching. Don't forget to like and subscribe. G Mama C out. Good morning, sweets. This is day number 2, and maybe going home this afternoon. I feeling so light here. So as I said, day number 2, physical therapy got me up yesterday and walked. And y'all, I was up and down all night going to the bathroom, and so that just made things worse as well as far as discomfort. But they are good about staying on top of my pain with the pain pills. And I did get a little nauseous last night. So other than that, that's it.
Getting discharged from the hospital, they have loaded me up on painkillers and all other types of goodies to keep me comfortable.